Good evening to everyone present here with us today. This is Shreyan from IGCP. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by our keynote speaker doctor for today's session. With much pleasure and honor, I would like to welcome today's moderator, Dr. Pranta Chakraborty. Sir is consultant hematologist, Zoho Corporation, Tinkashi, senior consultant, research and training center for digital healthcare technologies, Maulana Abdul Kalam University of Technology, West Bengal, head and clinical content and healthcare data, Noble Medicare Solution, Private Limited, Kolkata. Sir is
Okay.
member of Scientific Advisory Committee, National Institute of Immunohematology, Mumbai, National Committee for the Development of Framework of the Policy Guidelines for the Prevention, Treatment and Management of Hemophilia, Government of India. Dr. Chakraborty has been honored by Lifetime Achievement Award, Best Oral Prescription Award, Royal College of Physicians International Bushari for the study visit to Department of Hematology, Medicine and Bone Marrow Transplantation, King's College Hospital, London and much more. Dr. Chakraborty has more than 80 journals, 10 book publication on his own credit. Now, with the help of Sir and with the help of our respected panelists, we will be taking a close look on today's topic, which is side effect of Covishield vaccination. Now, without any further delay, I would like to welcome Sir at our forum and our respected panelists and hand over the session to him. Over to you, Sir.
Thank you. And I think it's good to see so many stalwarts with me, and it's a pleasure because once AstraZeneca said that, yes, there are side effects, and then they withdraw it, suddenly the people seem to be very much interested in the side effects of Covishield vaccine, though we have all taken the last dose more than 1 to 2 years back. So it's a pleasure for me to introduce our panelists one by one, and I'll start with Professor Dr. S. Arul Raj. He is an adjunct professor of medicine at Dr. MGR Medical University, Chennai. He was a university first rank holder, gold medalist, national professor of medicine of IMA, CGP. He has been awarded with the BC Roy National Award, and he is also chairman and head of acute medicine at Sundaram Arul Raj Hospitals. His medical interests are non-invasive cardiology and intensive care. He has published several updates, and I think he is continuously contributing to the science. And then my pleasure is to introduce my senior colleague from Kolkata, who is the director now, Center for Tropical Medicine and Parasitology, Centromap, Calcutta, who is a consultant of tropical microbial and infectious diseases. He was the professor and head of protozoology at Calcutta School of Tropical Medicine and in charge of Kala-Azar Clinic, Malaria Clinic. So more than 550 scientific conferences, international teacher, more than 100 publications. He has also received the Coates Medal from University of Calcutta and has contributed profusely in policy making of infectious diseases in India. And then I come to Dr. Rahul Pandit, who is an intensivist at core of his heart. So he was the face of critical care during the pandemic, and he's still managing. We were discussing. So he's a pioneer in critical care echocardiography and an expert in organ donation certification. So to look at critical care as a discipline, I think we couldn't have a better person. He's also an adjunct faculty at Sri Datta Meghe Medical College, Savangi, Wardha, Professor Emeritus at D.Y. Patil Medical University, Kolkata. So this is what we are. We have some of the most senior persons here, and we would love to answer even your questions, which you can always ask us through the chat box. So I think I'll start with Professor Arul Raj that, we are now hearing again that the vaccine which we took, which was called Covishield, somewhere it was called Shadox 19 according to its original name, developed at Oxford University, and then the patent transferred to AstraZeneca. So if looking back at when we took it and now, what do you think that we, the members of the medical community, should know about the vaccine, especially the side effects?
Thank you, Dr. Chakraborty. I mean, this is a eye-opening or public awareness creation session which you are heading and we are participating. Actually, COVID was a very, dreadful disease, all of us know as clinicians. And the vaccine was the boon. With that only we were able to control it and save human lives. And there were many types of vaccines. One is a killed vaccine, another is a live vaccine, another is a DNA, RNA, another is a, genetically modified, all those things. And in India, two vaccines were very popular, as all of us know. One is our Covishield, which Serum Institute of India was, manufactured, Pune was manufactured and giving. Another is Covaxin. Covaxin is a, dead or killed virus with a antigenic component, whereas this is a live one with a, genetic mutation that have started it. And most of us, or most of the Indians, have had Covishield. The number of people who have had, single dose goes to around 95 crores. And all the 3 doses, they are nearly about 75 crores of people have taken it. And I used to say, any vaccine or any drug will have some side effect. Will have some. Even take a paracetamol, take it in a liver patient, it may go in for a liver cell failure. Like that, depending on the patient's condition, depending on the drug, there can be some side effects which are, put into market after phase 4 trials only. Before that, it is not that. We try to exclude all the possible side effects and then we put it across. Still, there can be some side effect. If you see the, literature, it says there can be a local reaction, mild systemic reaction. There are a few more, vascular components or thrombotic components which are being said. But as clinicians, we know the incidence of complication is very, very, very low, 0.009%. 1 in, 100,000, that is only the range. And we are a solid proof for that. All doctors, we have taken 3 doses. Common man might have taken 1 or 2, we have taken 3. Therefore, this, what I would like to stress is, it is a live attenuated vaccine, gives a good immunity, genetically modified, very least toxicities. Now, in the court, there was a specific question, and they can't say no. They allowed to come out, and they have, come out of it. And the second thing is they have withdrawn. They may say it is due to commercial, but whether it is commercial or non-commercial, we don't know. The statement in the court, as well as their withdrawing of this product, has, raised a lot of doubts in the minds of the people. That we have taken this company says in court of law like this, and they have withdrawn the product also. Have we taken a wrong, vaccine? Will we get into some major trouble in the course of time? Our discussion, I am sure, will definitely clarify the doubts. Number one, the side effects are not seen after 42 days. That is a time limit. Now we have crossed nearly 2 years. Number two, the incidence is very, 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 very low. Those who have taken it not having had any side effects, now they will not have any side effect. They need not bother about it. That is a statement I would like to give Dr. Chakravarti.
Yeah, thank you. And I would like to go to Professor Nandi, that, because you had a robust vaccine reporting system under CDC and others. In our country, possibly it was more of a voluntary kind of thing. So what it is very clear is that, we are talking of TTS, which I'll come back to, and then VITP and all that. But because you were in this field, what was your observation in the community? I mean, was it there that so many people were coming and all that? And, sometimes we also have a bias. We humans are always biased. So if I am against the vaccine, I will see more side effects. If I'm not, I would say less. But as a person who has been in virology and protozoology for quite some time, what were your observations?
Now, thank you very much, Dr. Chakraborty. The question is, you see, whatever we talk henceforth, they are all guessworks, perhaps. Yeah, to me, it appears they are all guessworks because the company, whatever they have disclosed in the court, they have said that this is the side effect they have noticed. But in our cases, whether in India, whatever our observation was there, now in those particular cases, whether that's the same mechanism was in operation or not, that we do not have any idea. So I'm absolutely sure that for 100%, we cannot say that whatever observation we have seen was clearly due to the vaccine side effect. At best, we can say that some of the clinical features which remained unexplained during the period post-vaccination period are very highly supported by the information that such individuals had taken the Covishield vaccine. So that was the history. Now, whether we had no idea, we had no mechanism. For example, in cases of sudden deaths, we have seen sudden deaths due to cardiac failure, due to, say, brain stroke. And there are so many other clinical conditions which we suspiciously we could relate them to intake of the vaccine. Now, but we did not have any mechanism to establish that suspicion into the clear evidence. So this is what I want to make absolutely clear to our listener and just to assure them that these are all guessworks. And to list some of our observation, as Dr. Chakraborty was saying, now there would be few areas where we have seen there's a clear possibility. For example, in cases of patients who are already allergic, in particular the dermatological allergic conditions, say general autoimmune disorders, somehow there were cases, well, we do not have any hardcore data that out of how many persons vaccine taken, and how many of them manifested with this. But there were definitely flare of particularly the rheumatoid arthritis. We have seen psoriasis cases exacerbating seriously after taking the vaccine. We have seen serious cough, continuous and serious cough for months together after intake of the vaccine. And more importantly, we have seen quite a few cases of, say, phlebitis, particularly in the lower extremities, the legs, leading to cellulitis, swelling of the legs, and very nasty cellulitis. And we could guess, and one or two cases died of this post-cellulitis because of the sudden heart failure. I mean, perhaps due to thromboembolic phenomena. This we do not know. There were no mechanism of doing autopsies or post-mortem examinations, so we cannot say for sure that that was the cause. But these were our observations. Besides this, we have been observing some of the individuals after taking the vaccination, they are suffering from diseases due to different microorganisms. Say, for example, a simple rhinovirus, simple, say, a metapneumovirus, leading to extensive lung damage and finally succumbing to the infection. These were the cases we have hardly seen the such viruses resulting into such severity in the pulmonary disorders. And therefore, these are all guesswork that perhaps And one common factor was all whatever clinical features I had told you so far, that all of them, the common feature was all of them were vaccinated, COVID vaccinated. Now, whether COVID vaccine was responsible for all these manifestations, this we definitely we cannot say. This is absolutely a guesswork. So there is nothing to be worried about this, as Dr. Sundaram was also telling, that there was nothing to be worried about this, and we have already crossed significant time period after the vaccination program. So that was our observation. For example,
Thank Yeah.
yes, yes,
So
one
I
one
just
very
yeah, tell me.
one very typical example. So, for example, because these are the cases are in my record. One, we know that in case of chikungunya, the fever usually takes about a week's time to come down, and the patient becomes all right. I mean, as far as fever is concerned, although the joint pain remains for significant time duration. But there were two cases. One was dengue and one was chikungunya. The cases where the fever continued for 1 month and 1.5 months in case of chikungunya and dengue, respectively. Now, that was beyond our explanation. Why did it happen? Why this kind of things happen? Then we went for the immunological examination of these patients to demonstrate whether there were some alteration in the immune system's behavior. And at that point of time, we had no options other than just to estimate his CD4 and CD8 count and percentage. And these two cases, they had declined the CD4 count in the blood. So this is what I do not know whether the vaccine was the cause or just a coincidence. We do not
Even the
know. But
virus could have been the cause also, because we
absolutely,
yeah.
you are right. You are right.
Thank you. Thank you. So I go on to Dr. Rahul. So as was evident, COVID itself was a thrombotic disorder. Now you take a vaccine, and especially the adenovirus, both from AstraZeneca, which was from chimpanzee, and the other human was from Janssen, and they were also leading to something called TTS. So I want you to explain what TTS was, and while you were there on the field, say 2021, if you got these features, I mean, how could you manage them, or how could you suspect whether it was the virus or it was the vaccine? Because the vaccine was leading to decreased incidence, giving us some protection, but still after vaccination also people were having COVID, right? So
Yes.
over to you.
So, Professor Chakravarti, thank you very much, and thank you everyone for having me on this panel discussion. I will give you the more clinical on-ground perspective of what was happening in ICU. So, as you rightly all of us know that COVID itself was a prothrombotic disease. And not only just prothrombotic disease, we had many other symptoms as well, which we could just relate to vaccine. For example, just sinus inappropriate tachycardia of COVID, or basically insomnia, which was leading up to COVID. And then people also had virus-induced cataracts. People had vaccine-induced cataract. So there were non-critical side effects as well. But the most important one which we were worried about were the ones where there was thrombosis. So vaccine-induced VITT, vaccine-induced thrombosis and thrombocytopenia, which was basically a condition in which you would get clots, either microclots or macroclots, in the end vessels of our organs. When I mean end vessels of our organs means you would either get them in the coronary arteries, which were basically in the heart, or you would get them in the stroke, or you would get them in one of the peripheral vessels of the body. Even sometimes ischemic gut, ischemic liver, kidney. We've seen all of these complications, and it was, as everybody has sort of mentioned, it was very, very difficult to decipher whether it was the cause or was it the effect. So was it the virus or was it the vaccine? Especially after there was a brief period where we all took first dose and the wave was still going up. In fact, one of the observations which we had in Mumbai was a lot of old people who were going to take these vaccines in the vaccination center caught up COVID during the vaccination center. And as soon as they came back after the vaccine, 2 or 3 days later, they all tested. Many of them tested positive. Now, there you could also argue and say that the vaccine actually dropped their immunity down and they could catch up COVID. That's one of the argument which was also done at that time. But as Professor Nandi is saying, all this is speculative, sir. We have never ever proven that vaccine was the sole cause for all of these things. And I would like to emphatically say that the virus was more dangerous than the vaccine. And let us be very clear that today we are safe because we had a vaccine which came to us. Multiple vaccines came to us for rescue. And today we are out of the pandemic and we are treating it like a common cold or a common fever only because we could vaccinate our population. And it was no less feat to vaccinate 130 crore plus people, obviously, who were eligible. The children were out of the vaccination program for a long time, but who were eligible also were almost 100 crore people. And to vaccinate such a big population with 2 doses and some of them with 3 doses was a Herculean task. Now at ground, sir, it was impossible to understand whether it was the vaccine or not. What we were doing is that we had developed a protocol to treat COVID. One of the components of that was to treat the anticipated thrombosis anyways. So all of our patients were on low molecular weight heparin, and if there was a contraindication for low molecular weight heparin, we would consider an antiplatelet agent if it was possible to be given. And if there was a clear-cut thrombosis, then there would be a clear either heparin or low molecular weight heparin started up as a therapy. That was a clear thought process. In patients who had myocardial infarctions, which could be treated with intervention, we did offer them intervention and they did go in for angioplasties, angiographies. Again, the big question mark was why did they have it? Was it because of vaccine or was it because of the COVID itself? And I must say, sir, the mortality was slightly higher in patients who came in with COVID-like symptoms or post-vaccine symptoms with these thrombosis, as compared to people who we normally see in the population who come in with myocardial infarction. Now, this is just a very, very biased statement which I am making. It has got no documentary evidence to say that we had 100,000 patients on this arm, 100,000 patients on this arm, and we saw that the mortality was higher on the vaccine side or the COVID side. So I think we all would be only speculating. Now, what is the current situation? I think current situation is that we are now almost back to what we were in the pre-COVID era. Having taken 3 vaccines or 2 vaccines, or most of us, we should not be bothered about vaccine-induced problems. In fact, there are still some patients who come to me and symptomatically feel that since they have had COVID, their sleep is not good. Since they have had COVID, they are still not able to concentrate. Since they have had COVID, they are basically having a tachycardia or heart rate races up. So most people who have complaints about COVID virus, not about vaccine. So we should really not bother about the vaccine and vaccine-induced effect. And this is not a promotion of any vaccine, whether it is Pfizer, Covishield, Covaxin, all were helpful to us. If it was not for the vaccines, we would not be doing this webinar today, sir. And so we are all here because the vaccines could allow us to get back to a normal sense and could get back to have some normalcy in life. That's the long and short of it. I can give you a number of examples where we had to sometimes take up hard decisions of even ampute people's limbs because they became gangrenous, because they came in with thrombosis as one of the complications. A lot of people, like Professor Nandi said, had peripheral cellulitis, who came in with septic shock following peripheral cellulitis. And when we sort of treated them as normal sepsis or septic shock, we also found them to be COVID positive, or we found them that they had had a vaccine in the last 6 or 8 months. But I really can't say with any form of scientific evidence that there is a direct correlation between vaccine and the complications. However, there is enough evidence to say that virus-induced complications were many, and some of them were very evident that we were having bad lungs. It was proven on the CT scan. So I think the vaccine-induced complications were actually more proven for people. Sorry, the virus-induced complications were easy to prove. Vaccine-induced complications are not easy to prove because we never maintain data. I think that's one scientific problem that we had as a country. We never did. There was so much was an opportunity to look at almost, if not less, 10 to 20 crore patients were there at some stage having mild to moderate symptoms or no symptoms. we could have had the biggest database in the country, but we never had that that kind of a system to actually accumulate it,
Yeah.
talk about it.
I know it's strange because we all took the vaccine through COVID. So it was all digitally recorded. And we were also getting our PCR test done through another digital method with phone number and everything. So even if you're not looking at side effects, if you're looking at whether the vaccine was preventing the disease, maybe we have lost a gold mine. So I think, yeah.
Yeah.
And it's very important that, medicine is an observing science. So even when COVID came first, we thought we will manage it with ventilators. And then we realized that we have to use antithrombotic agents. And then we realized that steroids will help, right? So
Yeah.
we were learning in that process. And I think,
Ventilation will help,
yeah,
and high flow nasal cannulas will help. And if
yes,
you could avoid going on a ventilator, it would be the best for the patient.
yeah,
So there were so many learnings. Every first 6 months was a very steep learning curve, especially the first 6 months of the first wave. By the time we had the second wave, we knew a little bit about. I'm talking only about critical patients. I
yeah,
never. So I must have seen thousands of critical patients, but I did not see any OPD patients because I was
mm,
not doing an OPD. I was only in the ICU at the time. But sir, it was a learning curve with each day. And
yeah,
each day you would come out with new symptoms. Each day you would come out with new. We've seen GBS, post COVID GBS also I've seen, and
mm,
so-called post vaccine GBS also I've seen. So and
and it's so difficult
Really
because
great
when
learning.
90% of your population have been vaccinated, right? So how do you know it is the disease or it's the vaccine?
The
Yeah, yeah.
vaccine.
But I think I'll come to Professor Arulraj once again because
Yeah.
people are much bothered about the heart. And sometimes in the lay press, you see that you're having more sudden cardiac death. Actually, there were incidental case reports, even with Shadox and J&J vaccine of myocarditis. But I think with COVID per se, we were seeing more things. So people still believe that once we took the vaccine, our heart, can have problems even say in 2024, 25, something like that. So I want your opinion on this and how we can always communicate because there are so many doctors who have joined us today, that how do we communicate the correct information to the patients also. Over to you.
Yeah. See, as we are discussing two aspects, one is disease, another is vaccine. And both are likely to cause a vascular or a thrombotic episode. But what we get with the vaccine is the benefit, or rather the least number of complications. Without that, the complications could have become more. We have seen the death rate, how the people were all transported as in, the earlier epidemics. That was the stage. From there, we have come out of it. That is because of vaccine. Coming to the cardiovascular system, COVID has a capacity to affect every portion of the cardiovascular system. It can affect the pericardium, it can affect the myocardium, myocarditis, it can affect the autonomic nervous system, can cause either a tachy or a bradyarrhythmia, or the vascular coronary system, a plaque rupture, and then can go for a myocardial infarction, most easily a cardiac failure. All types are common in, COVID. We have seen it as, I think, Professor Rahul will, agree with me, in ICU, this is a common form. And the key treatments were three. One is oxygen. How to give oxygen was a very big thing. Lot of, oxygen administrators came. We wanted to, wean away from the ventilator. Second thing was heparin, low molecular weight heparin. Third was steroid. These were the things. But now the query is whether the vaccine can cause these problems. See, there is a guesswork that many people, even in Tamil Nadu, one cine actor who was very well, he went and came a shot, and that evening he suddenly, died. They said that that is due to the vaccine. This vaccine has got tendency to cause a thrombotic episode. That we should agree on that. But how many it has caused, to whom he will cause, it's a big issue. And people who were above 70 or 80, people with comorbids, uncontrolled diabetes or lung infections or already existing cardiac diseases, they will have to be very careful. Agreed on that. Otherwise, definitely COVID vaccine has saved, a large number of human lives. Because of that only we are also here. Therefore, my decision will be, the disease is capable of affecting the heart. Yes, in all forms. And the vaccine has a very remote possibility of affecting the cardiovascular system. Therefore, we should never hesitate to take vaccine. I don't know whether the fifth wave will come or not. I mean, there also vaccine may be needed. There may be a mutant gene. I mean, may come out with a new vaccine. Everybody will be asked to have a vaccine. Always the risk versus the benefit of the vaccine we should count. The benefit is more and the risk is low. Therefore, instead of, dipping on the, risk, we should, bet on the, benefits and see that all our citizens are, taking a vaccine. And those who have taken a vaccine need not fear about any cardiac or vascular complication. Anybody can get a cardiac complication. And take it that way. Don't apply it to the, vaccine. That is what I would like to, convey to our listeners and the community.
Yeah, thank you. So there is one question which is related to this from Dr. Tirthankar Vishwas. What could be the duration of all those symptoms like low platelet levels, etc., post-vaccination? So,
see, post-vaccination, it can continue up to 4 to 6 weeks. When there is low platelets, we are not supposed to use heparin, because heparin is likely to cause a thrombocytopenia. And this is one thing doctors should always be very clear. There is a thrombosis fine, but with thrombocytopenia or without thrombocytopenia. Without thrombocytopenia, heparin is a drug. When there is a thrombocytopenia, let us not use heparin. The newer oral anticoagulants are there, or an IV immunoglobulin is there, or a steroid will be there. Usually 2 to 4 weeks it recovers and comes up, the thrombocyte level comes up.
yeah. And it was interesting because in the WHO document in 2023 also they said, so first you will call it TTS, thrombotic thrombocytopenia syndrome. And if you get anti-platelet 4 antibodies, then you can call it vaccine-induced thrombotic thrombocytopenia.
Yes,
and
you're right.
actually, in the hematology field, we have seen a lot of patients post-COVID developing immune thrombocytopenia. So, all obviously the immunity was at stake. And the problem with COVID was once the virus was not there, the body, because of its guilt feeling, it missed it, it was destroying us. So
Yes.
all these immune things actually were creating problems for us. And I think people should understand that. Actually, Dr. Nikita wants to know treatment of TTS in patients who have taken both the doses of Covishield vaccine. So I think, Dr. Rahul, you again have to tell that, now obviously they will not get it, but how you managed it when they got it within 4 to 42 days.
Sir, Sundaram sir already mentioned that.
Yeah,
so
yeah.
anything which deals with any immunological affection of the thrombotic complications, you need to again modify it immunologically. So the best way to do is to either suppress it by giving steroids or use IVIG. That's the treatment for that. But you don't get the opportunity to do that all the time because you actually have an end organ dysfunction many times. So what you end up doing it is that if you have no thrombocytopenia, you end up anticoagulating them or treating the first problem and then coming back to the original issue that why it happened and then treat it. So I think Dr. Nikita needs to know that it's not going to happen anymore. And if it happens, it's not related to the vaccine. She should not think that it is vaccine related at all. If it does happen, and if there is no end organ damage, and if there is no thrombocytopenia, I think one of the immunological, she should consult with a hematologist like yourself, and then either consider a steroid dose or IVIG dose, which is what would be the treatment of choice for them. Having said that, not all of them would need to be treated as well. Majority of them would be a short-lived disease and would just improve. So how is the patient symptomatically? If it is just a one-off platelet count which has come low for a week or so, and it is not very low, not life-threatening, doesn't mean that you have to go and treat everything. So I think it needs to be taken on a patient-to-patient context. and it needs to be thought about how low is the platelet count, what is the thrombosis which we are actually talking about. Is it just a small minor thrombus in the periphery somewhere that we are getting worried about, or is it a multiple organs which are sort of getting affected? In that condition, we can think about going for these therapies. Otherwise, these therapies itself also have their own complications, and they don't come. So, as sir said, even paracetamol does not come without a complication. So none
Yes.
of them come without a complication. You buy something, you get something free with it.
Yeah, obviously. Now I come to Professor Nandi once again. So
Yeah.
Dr. Dipannita Das is asking us, what are the delayed adverse effects of Covishield?
Now, this is what exactly I was thinking to bring in front of our audiences and viewers. You see, whatever we have been talking so far, say Dr. Rahul also has emphasized, and Dr. Sundaram also emphasized the duration of the manifestation. So, if we consider the 42 days as the duration of this manifestation, now can we call it as a early manifestation, or delayed manifestation, or immediate manifestation? For example, for immediate manifestations, we can anaphylactic shock-like syndromes. That goes in the category of the immediate effect. And 42 days, we can say, for example, a very that long, not very long duration. But we are yet uh, remained unanswered to the question is whether the vaccine or even the COVID, because you see, we had a pandemic, severe pandemic, and over that particular situation, epidemiological situation, we introduced a vaccine. Now think immunologically. The vaccine, the COVID virus, definitely it stimulated the immune system of the population, and it behaved in manners we are not yet absolutely clear. On top of that, we introduced the vaccine. Now, what was the role of vaccine in such a situation where the entire population was already immunologically stimulated or sensitized? Now, whether that means, if we say that the COVID virus itself, the wild virus, had stimulated the population, immunological stimulation, and it was behaving in manners we have already explained in various ways. Now, whether the COVID vaccine was doing things like steroid do, rather, I mean, if suppressing all those manifestations through immunological mechanism, or taking another route to protect the individuals by development of a protective immunity. And that is a kind of a dichotomy we have not explained, we have not never thought of. This is exactly what I want to emphasize, that if we think that, now the question comes whether we should stick to the 42 days time frame, or we should think about that if an immune system like a system like the immune system had its own stimulation, whether by wild virus or the vaccine virus. Now that stimulation, through the mechanism of maintaining the memory cells, are capable of manifesting periodically under certain circumstances. Because if we say that 42 days is the time frame, we should not expect any vaccine related clinical manifestation now. And that clears everything, all the doubts that COVID vaccine at all, being Covishield or whatever vaccine, has got anything to do right now. And we don't have to worry about the post-vaccination problems. But if we think that, yes, the immune system was a system which played the tricks in bringing down the COVID by stimulating the immune system through protective mechanism. What was that protective mechanism? What was the immune system? What was the level of the memory cells? How far they are capable to the challenges of different kind of future stimulation or future infections by bacteria, virus, parasites, and whatever microorganism is. Because we know that there are antigenic sharing in the world, in the earth, that there would be antigenic sharing between viruses, between bacteria, between parasites, and so forth. So whether that kind of immunologically stimulated population would behave in a very abnormal or unknown way to our newer infections. And that my big question is that whether during the post vaccination or post COVID era, whether the entire world population is under challenge with this kind of phenomena which is not explained. And unfortunately, as all of us, we agreed that we have missed the bus. We did not set up any kind of investigative mechanism to find out what was the cause, whether there is any relationship between the COVID vaccine and whatever manifestations we have been discussing so far. Now that was the bus we missed. But even now, we can, I don't know, the immunologist can perhaps take up the challenge, can take up the initiative to undertake certain studies to find out what would be the basic mechanism, whether the entire population has a changed immune system, hypersensitive immune system. We do not know.
So one thing, can I add on to what Professor Nandi said? Can I just add
Yeah,
on?
yeah, please, please.
So, sir, this is a very same thought process which all of us have. That do we have a altered immune system now? And
Yeah.
something which we do in modern day sepsis or cardiac diseases where we actually look for a signature gene. I think that is very much possible to go and start looking for a signature gene to see whether there is still an effect of COVID or COVID vaccine which was given. We know the vaccine immunology, we know the
Yeah.
COVID virus immunology, and whether there is a signature gene which is still present in our body. And if it is present in our body, whether it can actually upregulate or downregulate depending
Yeah.
on the situation. So that is definitely possible. I have been thinking about that. It used to be my PhD topic, which I have not completed. Not this one, the sepsis and upregulation of antibodies, which I could not complete when I was in Sydney and I had to come back to India. But this is something which I've been talking with the professors in Sydney that should we be looking at. All of them talk about it, but nobody really wants to put their head into it. Maybe there is some research going on in somewhere where it is not
Yeah.
yet published out, but it is not difficult. What Professor Nandi is saying, it's not difficult. There is a well-established mass spectrometry with 2D gel electrophoresis process, which can actually identify abnormal genes in our body in a particular patient who has had vaccine or who has had virus or who has had both of them, and then can upregulate or downregulate that depending on giving a challenge to it. So it is quite possible. But sir, science is something which is obviously so unexplored yet that we don't know how much more we will know about it. But if you look at the human race, we are not doing bad right now. So I think we are okay. We are not that genetically mutated. Our children are still born normal. We still have a reasonable intelligence preserved. Yeah, artificial intelligence will kill it one day. But at the moment, we are quite okay. So I would like to believe that we are not that badly mutated.
Yeah. And I think so. If you, none of us should be worried about the adverse effects. But if you think that, something is happening to you, you can consult your physician. You can share your concern, because I have a question from Dr. Sharma. Have you noticed any common concerns or misconceptions among patients regarding the side effects of Covishield? And how do you address this? So I can go back to Dr. Ulraj.
Yeah, that I think we have, this
Yeah,
is
we have
the,
covered it. Yeah.
this is the, I mean, issue based on we have come on this platform today.
Yes.
Because since the Covishield has come to the front line because of the court statement and withdrawal, people think that they might have had it. But scientifically, after 42 days, there is nothing. If needed, as said by our immunologists, we can always do an immunological studies and antibodies, and then we can see. But my suggestion to the common man or to the citizen or our professional colleague is, you have had vaccines. You have completed 42 days. Your job is done. Anything further coming up, we'll think about the newer generation vaccines. Stop worrying about it. Tell your patients also, don't worry about the dates are closed. Anything you are getting on the same line, either on the cardiac side or on the vascular side or on the renal side, always consult your clinician and try to evaluate what is the cost for it. Don't keep on putting your bat on the vaccine. Now it is time bound. It is gone. That will be my strong advice to our colleagues as well as to the population. Don't worry about the side effects of Covishield vaccine.
Yeah. And there are so many reasons for which a pharma company withdraws a product. So there have been so many earlier also. The fact remains that it did its work when it was required. And it did its work in countries which could not afford mRNA vaccines. So there is no doubt about it. But we still know that the disease, it's not that today we are flirting with COVID because that's the variant we have now. Still, there can be some symptoms. So we are surfing the waves of the pandemic. We are learning in the process. And you have to understand that medicine is more an observational discipline rather than a pure science. We don't have laws like physics. So it is very important that we keep our eyes and ears open and we look at it, and blaming just because, see, if you ask me that if they did not accept it in court, even if it did not accept it in court, you can look at the NEJM articles, you can look at the publications where it was clearly mentioned what VITT was, what we were hypothesizing. And during this rare side effect also, as we learned, and there's a documented study from Australia, that the mortality rate, which was initially 50% for VITT, it went down to 2% within 2 months when the community became aware of it. So, it's all about learning, sharing. And there is another question from Dr. Somnath. Are there any other specific side effects that you believe require further research or have been underreported? At this point of time, I think there is nothing like that. But remember that you have learned certain things. So if you have a so-called common cold, please don't go to a crowded place because you'll be infecting others, whatever be the virus. So I think COVID also taught us some basic elements of public health. Vaccine was one element, and it was for the first time. You can imagine that hepatitis C virus is an RNA virus. It has been there for more than 3 to 4 decades. We have still not been able to develop a vaccine. But we did it. I think science and technology did it. And it was done with a purpose only that, mankind needs to survive and it needs to go on. So if you think, I can belong to any lobby, right? No problem. I can be anti-vaxxer and I can say a lot of things. But if you hear such things, because there's WhatsApp University, there's Facebook University, Instagram University, ask for the evidence. Ask for the evidence. And we are telling you that we have managed the patients. We have ourselves taken the vaccines. And that is what we have learned. So I think, Dr. Rahul, you wanted to say something?
No, sir. I completely concur with whatever has been said. I don't think after what Professor Sundaram said, there is nothing to worry about it now. I think that should be the bold statement, that do not worry about vaccine-induced complications now. That's the only statement we would like.
And the vaccine cannot change you, but looking at the mobile for 10 hours can actually change you. I think you have to be very careful about what you do. Think of a healthy lifestyle and always think that the next pandemic can again come, right? Because the viruses are smart, right? We try to be smart. We have tried to do something. It was a joint effort of the entire human population, and we have tried to do what is best. But unnecessary trying to do something which causes certain doubts, which then make, even during the pandemic, I think you'll all will agree that people who took the vaccine suddenly thought hand washing was not required, physical distancing was not required. But those are the basic things which we learned during Spanish flu, when we did not even know whether it's a virus or bacteria. So there are certain things which we should be smart enough. And if you look at this rare side effect, it's good that it has been documented, because there was a monitoring system in certain countries and they looked at it, and the incidence has been in different age groups different, but roughly it comes to less than 1 in 1 lakh doses. And it's sometimes it's around 2 to 3 per million doses. So it comes to 0.2, 0.3. We have all received the dose. We have our certificates. It's time. And, I agree with Rahul, because many people start today's consultation saying, when I had COVID, I had received it. And things have been made complicated because something which is called long COVID, though it has nothing to do with the vaccine. And then also, it is also so much subjective that you can always feel that you are not feeling well. So that kind of things go on. But I think on behalf of the panelists, we have just 3 to 4 minutes now. I'll ask everyone to give their concluding remarks. But our opinion is that right now, you should not place any doubts as to a particular molecule which you have taken, which has saved your life and is now ensuring that you can think about hundreds of other things. So I go to first Professor Arul, then Professor Nandi, and then Professor Pandit for your concluding remarks.
Thank you, Dr. Chakrabarti, for the excellent summarizing. The message that we like to pass on to the medical profession and our Indian community is the benefits which we have received from the vaccine is much beyond than very, very, very minimal side effect which is there in everything. You take food, there is some side effect in that. Like that, we'll ignore about the side effects of Covishield vaccine and let us go ahead with our own, day-to-day working and not bothered about the vaccine at all and its side effect. That will be my concluding remark.
Thank you. Yeah, over to Professor Nandi.
I would only reiterate to whatever you have said, that we should continue the mask. It's not only for the COVID or similar diseases, but it's looking into our country's situation of communicable diseases, particularly airborne communicable diseases like tuberculosis, for example. I think the way tuberculosis is increasing, and many other viruses. So for example, the new variants of COVID virus, now they are present in Maharashtra and Pune. So looking into all these, we should make a daily habit of wearing a mask whenever we go to the crowded place. That is my final suggestion. And the other one is that keep your eyes and mind open. Don't just go on rely on the guesswork, but try to produce evidence, because science is always evidence based, and more so the medical science. It is always evidence based. We have to create and generate evidences to say something. So that's my statement. Thank you very much.
Thank you. Yeah, over to Professor.
So, pertaining to the topic for today, I think I agree with two of my senior colleagues. We should not be thinking about vaccine and vaccine-induced complications in 2024, period. Let's not think about that. Coming to the mask, I still wear a mask, sir. It's right next to me.
Yes,
Continue to wear
I
that.
also am.
And
Every day I wear.
most of us wear a mask every day to work.
Yeah.
Most important thing, sir, I would just like to take one more minute to sort of remind all of us that in 2009, 2003, we had the SARS. Then we had the Middle Eastern virus. Then we had in South Africa, we had Ebola. So the viruses are hitting us all the time, wanting to create another pandemic. So we just don't know whether we'll see another pandemic in 100 years or in another lifetime of ours, we'll see another pandemic. So we should be students of science, and we should keep our eyes and ears open and watch out for these viruses, because they have lived on this planet millions and millions of years before we even came across. So they are very, very clever. They know how to mutate, they know how to change. We are thinking virus, we are thinking that the vaccine mutated us, but virus have developed their own capacity to mutate themselves. So they are highly technologically advanced because of the cellular mechanism which they have, whereas humans, which are multicellular organisms, cannot do that, whereas they can do that. So we have to be very, very clear that we should not be complacent. Follow the rules, follow the what COVID taught us was like a guru. The public health for precautions which it taught, we should take it like a guru and accept it like a student and continue to follow it. Thank you.
Thank you, Dr. Rahul. So, yeah, we have also addressed all the questions which are asked. So, next time you try to blame the vaccine, you keep your eyes and ears open. And this is also for my fellow colleagues, in medical practice, your observations matter. So if you see something and you see certain clustering, please share it with the community. Whatever you see, I'm going beyond this pandemic or anything. Share it with your colleagues and always try to document it. So others can learn. The person who first saw it in China and what has happened, I'm not going to that. But the observation was so astute that people became careful. So this observational power which we have, and fortunately, still the human brain is far better than artificial intelligence. So use it, always discuss it with your colleagues. And if you have any sort of doubt, you can always consult. So because today knowledge has been democratized to a lot of extent. During COVID, all the publications were full free access and we all were sharing it. So I think those lessons also come, and a platform like this where we can all share our concerns. Thanks for sharing the questions. We all are on the same boat. We are keeping ourselves very, very vigilant, because I'm in Tamil Nadu, near Kerala border. Now it's West Nile fever, right? So viruses, so the basic public health infrastructure and those related things, we are the individuals who can contribute to the nation's health. So thank you once again. Thank you, Professor Ulraj, Professor Nandi, and Professor Rahul. It was pleasant discussing with you. Now I hand it over to the organizers. Thank you very much.
Thank you so much, sir. Thank you all the panelists for joining us today, and it was a wonderful session. With your permission, sir, I would like to conclude today's session. Thank you.
Thank